Hi, nurse practitioner, functional nutrition, and fitness coach Nicole here to talk to you about the diagnostic approach to postural tachycardia syndrome, also known as POTS. Now, as always, these videos are for information purposes only, not meant to diagnose or treat any one person. POTS is a disorder characterized by symptoms of orthostatic intolerance, which is the ability to stand upright without symptoms such as high heart rate, lightheadedness, dizziness, blurry vision, palpitations, anxiety, nausea, shortness of breath, or headache. In a previous video, I covered the signs and symptoms of POTS. Now let's get to the diagnosis. People with POTS are typically young, between the ages of 15 and 50, and predominantly female, with a ratio of 5:1 women to men. And a large cross-sectional community-based online survey of patients with POTS revealed half were diagnosed with POTS in adolescence, and more than 90% were white females of childbearing age. The prevalence of POTS is estimated to be about 1%, though that is low in the total scheme of the whole population. Those people who suffer from POTS generally daily have a lack of quality of life and can possibly endanger themselves or others depending on the severity of the attack and if it's also accompanied by syncope or fainting. The key physical finding in POTS is a heart rate that is excessively high within that 10 minutes of standing. So it starts normally when we stand up, we do have a normal increase in heart rate to compensate for that drop in blood volume that goes down into your abdomen and your legs, like I talked about in the previous video. And that's a normal reaction to try and increase the pumping action of the heart so that we can pump the blood and get it moving. We also need the muscles to pump that venous return back up. With POTS, there's like an overactivation of this system. So instead of a normal rise, it rises and then it keeps rising. And one of the few things that will relieve it is laying down or at least sitting while putting the legs up. Orthostatic symptoms often vary by day, week, or month, such as in correlation with the female hormone cycle and premenstrual time period. And it can also be correlated with, severity as far as if there's any underlying hormone abnormalities or chronic stress. Now, we also need to take a look at medications that can affect the heart rate. For example, beta blockers such as metoprolol, which is very common, will lower the heart rate, which is its action, which is why we prescribe it for people who have high heart rate, but this could mask an underlying POTS syndrome. And then there's medications that will increase the heart rate, could give a false positive for POTS. These include things like adrenergic stimulants such as dobutamine, norepinephrine transport and reuptake inhibitors, NRIs, ADH medications such as atomoxetine, anticholinergics such as the antidepressant Paxil or antihistamine Benadryl, and beta adrenergic adrenoreceptor agonists such as those ending in buterol. These can magnify the heart rate upon standing. So if you go into a clinician's office with complaints of signs and symptoms of POTS syndrome, they'll likely run some tests, things such as a table tilt test, sudomotor testing, labs, electrolytes, complete blood count, total thyroid panel, and we might even look at some other things like an EKG, which measures the electrical activity of the heart, an echocardiogram, which measures the blood flow through the heart, and we can see the actual pumping action of that, and if there's any, valvular abnormalities or anything like that going on there. And we can also look at cortisol levels and more testing depending on the history and other symptoms that are present. So we need to rule out any other causes that could be underlying here. Dehydration, that's a good one. You'll result in high heart rate again because the blood volume is low and the body just needs to compensate for that. Medications, which we reviewed. Orthostatic hypotension, which is different in that, yes, when you stand, you're going to have symptoms, but it's because the blood pressure is dropping first and then the heart rate is increasing to compensate for that. Reflex syncope, which can occur with POTS, and that's again when you're standing and you pass out from prolonged standing. Maybe you're locking your knees or something. Doesn't have to be there though. And that's its own distinct condition, but it can coexist with POTS. Chronic isolated orthostatic tachycardia, and that's just when the heart rate goes high but you don't have symptoms. That's not POTS. It's just something different. Inappropriate sinus tachycardia. Now that we will see a high heart rate even at rest. So it needs to be distinguished, also can coexist with POTS. Panic and anxiety disorders, and these coexist with POTS in many instances. And a lot of times women will actually get put on anti-anxiety medication or antidepressants when they actually have POTS underlying. And so this really needs to be distinguished, and so it can be treated properly. And there can also be spontaneous intracranial hypotension and Chiari malformation. So it's very important that we look at the full range and evaluate if there are any other underlying causes here or something else that could be explaining our symptoms. In the next video, I will talk about the treatment for POTS, including diet and lifestyle. If you liked this video and found it helpful, useful, informative, please like, comment, share, follow, or subscribe. Be your own advocate and take charge of your health.